you have some experience, we're going to make it a little bit more challenging for you and simulate how to do IVs in children, because it's a little bit harder to do. The way this works is, as you know, when you put IVs in, you always want to stabilize the hand and put some tension on the skin, and you can do this here. By just rolling this, that will put some tension on the skin and stabilize the vein. This is a device that you can manipulate, and I'll show you later on the screen how that works. And this is the actual needle that, as you know, goes into the catheter that goes into the vein. So there's a little history of the child. So he was a pedestrian and he was hit by a car, and he's unresponsive and he needed to be intubated. So he's doing pretty poorly right now, and he needs access so we can give him IV fluids and medications. You see all the tools on the left side, and just click on the appropriate tool. So you're going to put the tourniquet on first. Okay. Right. That's good. Now we basically have to palpate and find the vein. It's a little bit tricky with the children. Sometimes they're high, but if you palpate them, they get bigger and larger, and then you may be able to see them better. Now you clean it, okay. Again, we put in an IV in, so the betadine is the right thing to choose. Otherwise, if it's only a blood draw, you can choose the alcohol swab and take a good swipe around the area. That's right, start in the middle and then go outside. So now it's all nice and clean. We can't do it in a real patient, but let's see what your chosen point looks like, because we can look underneath the skin and see where you are. You're in perfect position. You see that? Right there. There's the angle, and that's where you're going to enter. So you should be in good shape. There you go. Perfect. Very nice. Now stabilize the catheter and take the needle out. Right.
You know what I found particularly useful and that I learned from my virtual surgery session was that I was able to see the patient's venous anatomy when we used the transparency tool, and it was nice to actually superimpose that picture in my mind with the exact same anatomy of the image of the skin, and in that way I could be imagining the venous anatomy as I entered, and that was really helpful.